Thursday morning, Gina is on her way to work, and like any other single mother of two girls, it can be very challenging. Gina works two jobs so she is able to provide for her little ones. As Gina walks into work in such high spirit, thinking the day is going to be smooth, boom, her boss calls her into his office. Like any other normal human being, you will have all types of things roaming around in your head. So then her boss explains that it's been wonderful having her on the team, but due to budget cuts, he has to lay a few people off, with her being one of the few. Now for Gina, this decision couldn't be good because she is already trying to get by with the little she does have. And by her losing her second job, she could also lose out on being qualified for health insurance due to the new Trump healthcare plan. Now that Gina doesn't make enough money to afford health insurance, she and the girls are going to miss out on the health checkups they need in order to live a healthy life. This is just showing the harshness of President Trump and how he's trying to keep down low-class working people who are barely making it. And not only are they being paid minimum wage, but to not be able to afford health insurance is hard as well. I would like to mention a claim from the New York Times. The Trump plan to hurt the poor by pretending to help them. Trump administration said it would get low-income individuals to work by letting the state government deny them Medicaid if they don't have a job. One of the first issues of the article that I would like to comment on is how it is very hurtful to the low-income families that the Republican lawmakers are demonizing the program as welfare for able-bodied adults. According to a recent article by the Oregon Health and Science University, the low-income families that have health insurance are having even much harder time getting the care they need as well as paying for it. Now, with the new Donald Trump healthcare plan coming into stone, it's going to make receiving healthcare even harder for low-income families, single households, and even the elderly. In fact, it will also hurt individuals who have lost their jobs and can't find another one fast enough because Donald Trump is really hurting families, single households, and the elderly who are barely making it. The editorial also made a key point on how the national median income limit for a single person to be able to qualify for Medicaid is $16,642 a year. Now, in another article, the Medicare and Medicaid services are also claiming that it will encourage more Medicaid beneficiaries to receive a job and also promote better mental, physical, and emotional health, but their facts were untrue. In a study from The Economist, it also informed that the new health plan isn't beneficial to the people who are earning more than 400% of the poverty line, which in other words are the middle class and self-employed. Also, it is hard working in America and not being able to make the money you know you should be making. And on top of that, not being able to fully afford health insurance could be a lot to handle, especially when there was a healthcare plan that was beneficial to all class groups. Also, taking Medicaid away from people who are out of a job due to several reasons can damage the vulnerable people that make up our country. Those human beings who lost their jobs could be due to them taking ill, getting laid off, or the economy change has made their skills less useful. But to also have your health insurance stripped away from you because you can't afford it, it can be hurtful. In the latest article, Roger Fleeman, a professor of health policies and management at the University of Minnesota, stated that this strikes me as a mixture of what is mostly Republican orthodox, with a couple of oddball proposals. And the main issue overall is to not turn a blind eye to the individuals who are less qualified to receive health care due to their financial status. I solely agree with the editorial as well as the other articles to an extent because their points and facts were questionable at times. But at the end, I felt like we all were making valid points. I personally feel that Donald Trump and his administration are only looking out for the rich and not fully understanding that the lower and middle class are the ones who fully need the help. So, I ask this, how can you expect individuals to be able to qualify for health insurance if they're barely making enough to pay for their everyday expenses? I say, if the government raises minimum wage, then people can actually start getting paid what they deserve. And it won't affect people being able to afford health care. Thank you, and I hope you guys enjoyed my speech.